Hi, everybody. My name is Matthew Taylor. I'm Vice President here at NextGen Healthcare, and today we're going to give you a quick flyby of the population health solution that we have. So excited to show you that, and by all means, this is going to be really quick overview and hopefully enough to pique your interest for more. We're not going to try and cover everything, but really highlight the essential items. So with that, I want to introduce you to who is going to be on the phone today. And so with that, first up, we've got Dr. Jen Boldock. She's our clinical lead on the product, key influencer here at NextGen, trained as a pediatrician, worked for the Navy, worked in private practice in Walla Walla, definitely had some product experience at some other products, but, we've been graced with her presence here at NextGen for the past 3 years. And she's just doing a great job in terms of really helping us shape where we need to go with the product. And next up, you're going to hear a lot today from Brian Sowers. So Brian Sowers is one of our most experienced product manager here at NextGen. So he's been with the organization through a number of different acquisitions. And what's, I think, critical about that I would highlight is just because of that journey and really where our focus is now shifted as an organization is really around trying to harness the power of an integrated platform. His experience, particularly with population health, and just the experience with the other products along the way, really is helps us harness that power. And you'll see that come to light today through some of what he shows with really across the product. And then for me, you're not going to hear from me too much, but I've been here for about a year and a half. Prior to that, just had several different roles in both provider and payer organizations. And last but not least is James Duncan, in terms of our primary sales executive. So lots of experience in healthcare, and with NextGen, has sold this solution to a lot of our clients. So as you have follow-up questions, undoubtedly you probably will have at least one, if not more, conversations with James. And so along the way, you're going to hear from several of us along the way, but that's sort of the primary cast of who you've got today. All right. So the agenda, in terms of just walk through a little bit how we got here, and that's not just we, but maybe you as well. Go through some key questions in terms of as we think about it. We're going to go through again, try and give you some scenarios that we think resonate with our physicians and just audiences in terms of what struggles they really have as in their daily practice. And then we'll share some facts and client testimonials at the end. And I'd say, to the extent that you feel comfortable, whether it's raising your hand, interrupting us with a question, or, using the chat or the Q&A feature, we'll sort of, anything we get that lets us know you're alive, I think we would appreciate. So we'll take whatever you can get, and we're happy to be interrupted, if you will. So, all right. So as we get started in terms of thinking about, how we got here, it's important for us to talk about, really one of the founding members of the product. And so I think 5-ish, maybe 6 years ago, Dr. Betty, who is, by trade a family practitioner, and, she worked in an academic medical setting here in the local area for me being Rochester, decided to say, hey, I really want to invest and build a tool really for physicians and their staff that can really focus on population health. So she set out in a joint venture with, some other partners and started that work. And so those assets eventually got acquired by NextGen in the fall of 2017. And so they've now been in the organization, NextGen, for, 3+ years, I guess four, soon to be four. And so we feel like that's important because, just the DNA behind the product in terms of, and Dr. Betty is, now the Chief Medical Officer for NextGen, strong voice in the industry, certainly within the organization, just has a really great vision for the product. And she's, graciously handed that baton off to Dr. Jen Bolduck, who you'll hear from today. So just having that sort of the design and kind of the DNA of the product in mind, driven by a physician, somebody who, is very used to counting clicks to do things, and okay, how do we make this simpler and easier to do? Is just an important thing to remember. So, and so this is a place where we like to start out in terms of, so as we think about, the different audience members, we've got, we one of the things we recognize is that, everybody should be able to find themselves on this continuum. And what I think we recognize is that it's doubtful, at least to me, that anybody finds their particular practice or their group wholly in one of these circles. So, global capitation might be an exception, or a health plan, maybe an exception. But for the most of us, we feel like there's a number of different sort of payer arrangements you have, whether it's with a commercial payer or whether it's with a payer like, CMS, or, the state government, whatever. But there's probably a mix of different payer arrangements. And so this is important for us to think about, because I think the thing we recognize is that provider groups are likely at different places on the spectrum. And this helps us focus where we're going to focus the product. And so you can see there, in terms of that green circle or oval, that's where we're really aiming. So we're not trying to target global cap plans maybe out that you see very prominent in the West Coast, and health plan organizations. And you can see with that, Brian, if you click the next one to advance this is just a list of, these are the capabilities that, we really think are important, in that space. And while we're not going to show you all of those things today, I would ask that you sort of take me, in a word of faith that, if you give us the time, we'd be happy to show you all those capabilities. So all those capabilities that you see listed there are in the tool, in a variety of capacities. And so, regardless of where you find yourself on that continuum of risk, or whatever that looks like, we feel like, universally, I wonder how well these challenges resonate. One is, we hear repeatedly from physicians that, they're just not satisfied with their access to patient data. Dr. Jen likes to tell us, like, tell me what I don't know. I can see what's in the EHR, but there's stuff that's happening to this patient that may not be in there. Maybe they went to a different system. Maybe they went to the hospital, there's all sorts of reasons. And then, survey work that we've done in terms of, many physicians feel like, value-based care will have a negative impact on their practice. So I've heard from a number of physicians that, have, I don't know what the right word is, they've communicated to me, that, they feel like it's just checking the box, or it's like, hey, these process measures is not really about quality care. I'm just doing this because this is how the payer wants me to get, all sorts of reasons. And then I think most fundamentally, and this is the one that, I hear all the time from my neighbors, some of them who are primary care physicians, is they spend more time in the EHR than they actually do with patients. So my neighbors, if they're anything like you, they do their work, they try and, do as much as they can during the day, but they grab dinner with the family, and then they come home at night and have a glass of wine and do their charting after work, after dinner, and they're spending 3 hours, doing that. So regardless of whether that's you or not, we feel like anything we can do that can help you spend less time in the EHR, but do the critical things that you can do, is really important, because most of you probably didn't go through medical school, or your practice didn't, to, spend time, doing data entry in a system. So.
Hallelujah.
Yeah.
Right, Matthew?
Yeah.
And just to chime in here, my husband is still I don't practice any longer, but my husband is a pediatrician and he's still in practice. And so I hear about this every single day. The notes that take longer, and the check boxes that have to be checked, and the check boxes that check the box to show you that you've checked the box. Gets kind of crazy. So yeah, I'd love to just reinforce that. We get it.
Yep. So, there's all these different places to start, and I think I'll throw myself in this category of, I think it's really easy to try and overcomplicate population health. And I think that's where, when I think about this slide, really the intention is, think about this when you go to um, an amusement park or you go to the mall, especially somewhere big that you've never been before. What I find myself doing is I'm like, okay, where am I? Trying to remember where I parked, like what door am I going in? What do we want to go to? So this is the red dot on the map that says, here's where you are. Okay. And so there's really kind of three things that I think about when we think about pop health. There's intelligent insights. So there's some insight that you're getting, whether it's the clinician's clinical judgment that's coming from maybe what's being presented in the exam room, or maybe some information in the chart, a lab result, something the patient's telling, whatever. It could be analysis that's coming from the system. There's some insight that you want to take action on. And there's two things you can do with that insight. One is, if you know about that proactively, ideally you can activate your patients in advance. So you can maybe reach out to them and do some prep work before they actually come into the office and say, hey, could you get this lab work done so that by the time you get here, we can actually review the results of your fasting blood work, as an example, or, get other procedures done. The other option in terms of is, if you can't do that necessarily proactively, maybe you can do that best in the exam room. And so what we've heard over and over is that, that time is already really condensed. There's a lot that's being tried to pack in there. And so there's a need to really crystallize and be precise and concise about the information or the insights that's coming through there. So we've seen other tools where maybe a litany of things that need to get done get presented. And, we've seen clinicians, kind of tune that out because it's just overwhelming. It's like you're trying to push 40 insights into a space where maybe 5 can do. And so we feel like, again, back to the being aware of access to information, and just time spent in the EHR, if we can really crystallize and make use of that sacred window, that's a focus for us. So at a high level, what you're going to see today, in terms of the different scenarios that Dr. Jen and Brian are going to walk through, are going to touch all of these things. So the insight's going to come from somewhere, and you'll see this. So everything we're showing you kind of fits into this context. And so with that, I think I'll turn it over and let the magic begin.
All right. Oh, thank you, Brian. I was just going to ask you to give me the power. Let's see if this goes. You guys can see my screen and hear me well? Awesome. Okay. So the first scenario we're going to do is we're going to take you on an end-to-end journey with this one. And I think it's an important one to talk about because when people talk about population health, the first thing they often think about is, how do I close gaps in care? So we're going to show you exactly how we do that. And so we're in the population health tool right now. And we're going to simply click on, and in the left here, you can see gaps in care. It's one of the tools within population health. You can see a bunch of different gaps pop up here. We're going to drill down. Right now, this is set for the entire demo system, for all the patients within that, but I'm going to actually drill down into one provider's set of patients, one group. So I'm going to be Dr. Jeff Sinclair today. So I've got his whole panel and all the gaps that we're seeing here. And then we are going to go down to the breast cancer screening metric and the gaps in care there. So here we're looking at patients who are in Dr. Jeff's panel who are past due for mammograms according to the breast cancer screening UDS metric. And you can see with just a couple of clicks here, I have drilled down into, you can see here, a list of 39 patients. And we're going to go ahead and click on that. And here you can see this list pops right up. So we have all these 39 patients, everything about them in our patient list that we want to know. And we're simply going to export that list this way. So I'm going to export to NG Care, which I hope some of you are familiar with. That's as simple as it is. And then I'm gonna actually stop sharing and I'm gonna send that list to Brian so he can show you what we do with that in NG Care.
Great, thanks, Dr. Jen. Let me go ahead and jump into the NextGen EHR. So inside the NextGen EHR that you're so used to using with Pop Health, you get NextGen Care, and you get the application called the Population Management Hub. So this is like an integration touch point where we can take that list and take action. So we can go ahead and import that list, and then we can grab that list of patients, and we can do many different things. For this example, I'm just going to focus on two things that we'd like to do. So I can either select one patient or I can select many patients. Let me go ahead and select the whole list real quick. And one thing we'd like to do is place an order. Instead of going in each and every chart, we have the ability for lab and radiologies to set up predefined labs in radiology that we can select from the list. So we can go ahead and select that, select from predefined diagnosis codes, and then I can go ahead and place the order, and it'll place it on all those patients' charts. And if you want, depending on what data you captured, we can actually send it out to the vendor. So we can put it in the chart, and if you want, we can process and push it out to the vendor. Another nice thing we might want to do is call the patient in action to alert them. So we can come here and send them an outreach message. So I can come here and have different campaigns set up. So I can go ahead and select the breast cancer awareness and go ahead and hit send, and it will then send it out to those patients. So we can reach out to the patients based on how you have your campaign set up and the patient's preferences. So we can send it out via patient portal, via secure message, via email, via text, via voicemail, via letter. There's many, many different ways we can set them up. So again, we can consider how you set it up, the patient's preferences that you recorded in the demographic screen. And we can also take in consideration the patient's language. So if you want, you can have your own version of each message in Spanish or French or whatever and send that out. So we can go ahead and send that out. And then it will automatically document in the patient's chart so you know that you reached out to this patient.
Thanks, Brian. And so that kind of ties back to, you know, what Matthew was saying about finding the insights and so those intelligent insights and then being able to act upon them very quickly, very efficiently, and it's all documented where you need it documented. James, I just want to pause here for a second and see, are there questions so far? Anything that we want to call out?
I do have a question. Absolutely, sure. Dr. Jen. So the spirit of the question is, can you illustrate as you're walking through the scenarios how we might be able to extract information and perhaps report on a population by provider as an example?
Oh, okay. Well, let's show you. I think one of the kind of cool reports we have. I mean, we can export any list like you saw, but within metrics, I'm going to just reset for a second. I like the metric report. And we're now in the metrics section. We're reporting on the entire demo system population and their providers. And so we're just going to view report. And you can see here that we've got a number of providers listed here. And across, if we scroll, and pardon me for the scrolling, you can see the performance in various metrics across the way. So we can export that performance. And then if we wanted to, we could even, let's look at Jeff, Dr. Jeff. We can drill down to the patient level and export that data as well. So just a couple of, is that what you were looking for there, James? Does that answer the question, do you think? Okay.
I think that gets to the spirit of it. And just as we got into metrics, there was an additional question of, can I customize the metrics as you showcased on the dashboard? So we can certainly speak to that. There's a great deal of customization available out of the box. You would have, as a client, the opportunity to choose metrics that would be showcased on the dashboard. We have a catalog of over 170 and growing number of metrics that we've executed with our clients. So as we showcase here on the metrics dashboard, you would be able to configure which metrics would be showcased here.
Absolutely. And just to speak to that a little bit more, for this demo system, I asked for some that kind of that are representative of the library. So we have a few, and you'll see the list here. This is not by any stretch all that we have, but we have ECQMs from CMS measures. We have HEDIS measures. We have UDS measures. Fairly soon, we're going to have Indian Health Service measures. And I have a couple of extras here. One is the COVID-19 immunization status. That's one that we built that we've given to all of our clients. And then there's a Medicare annual wellness that we had one client in particular help us develop that can be used by anyone. So a bunch of different types of metric programs there that helps illustrate that.
Dr. Jen, one additional question.
Sure.
The spirit of the question is, can you showcase how the platform can drill down on a per provider basis? So perhaps we showcase the filter and maybe look at a population.
Oh, just from the, well, yes. So we're going to actually go into another set of scenarios on different ways to generate patients of interest, right? And generate some of those intelligent insights that Matthew mentioned early on. So let's do it. I think the first one may show this. So we're going to go to population, and please do tell me if I'm not hitting the mark. So in population now, and we've got 862 patients in this demo system. We are going to drill down on our Dr. Jeff here. We're going to be Dr. Jeff again. You can see by selecting him, I've reduced the total population, right? And then from here, we're going to go ahead and dive into risk. So this really takes Dr. Jeff's panel of patients and then risk stratifies them. And so here you can see that there's our drop down for our different types of risk algorithms. We have 3. The default here is the ACG, the Johns Hopkins ACG risk algorithm. And you can see we have HCC and ASCVD. That comes standard with any implementation of our Pop Health tool. And then if we forget what ACG risk is, we've got a little eye there that you can open up just as a reminder of which one this is. It's nice to have those little helpful, I think they're called tooltips in the application. So this is risk stratifying Dr. Jeff's patients using the ACG criteria. And then from here, I want to show you what we can do with it. So at his patients with the very highest level of risk, that risk score of 5, he has 3 of them. And I'm highlighting here that those patients have been seen in the last year. So Dr. Jeff's doing really well with them. And even with the patients that have a risk score of 4, there's a bunch of them and they've all been seen. This isn't typically what we see. Usually there are patients who've not, and I'll show you that in this next risk category. So we're down in moderate risk. He's still doing pretty well, but this group here may be a group of patients of interest. So these are patients who've had no visits in the last 12 months. And these are the kind of patients that would worry me. You know, I know they've got moderate risk levels, and I don't know what's going on with them as a physician. So they may be deserving of some kind of reach out. So that's one group of interest. Like I showed you before, we simply click into that set of patients, and then we've got 48 of them. We may decide to stratify them a little differently. We may want to look at, do they have an appointment coming up? So here in this patient list, I haven't shown you this yet, but there are a number of settings, and we can see what we want to see here, and we can choose the order in which we want to see them. So we've got the risk score, in this case, last appointment, next appointment. If I wanted to see when they're, let's see, you know, we could do last wellness appointment, for instance, and we could pull that up higher in the list. And let's go further up so we can really see it and utilize that. We'll put it with the other appointment categories there. And then we see it right next to, here's our last wellness appointment. So say, you know, of these patients who are at moderate risk who haven't been seen in the last year, you know, do they have any last wellness visits? They don't in this demo system. Do they have any upcoming appointments? Can sort on that, and we don't have any in there. And then I can look at the last general appointment. When were they seen at all in the application? And here we can sort by most recently seen if we do it that way. But what might be of more interest are the ones that were further out, you know, so these top patients here were last seen in 2018. Maybe we want to go after those patients first and maybe start with a smaller list. We could filter on this and then choose the patients that we want to send to Brian to have outreach done. So that's just one way to use that. So that's a lot there. That was one scenario. Questions about that?
There is a question, Dr. Jen, if we
Sure.
could just showcase again how through the icon export, does that allow us to then take this information and manipulate it as a report as an example? So I think you're going to showcase that.
Yeah, absolutely. Thanks for asking me to open that up. So far we've sent the list to NGCare to Brian to take action on from that perspective, but you can certainly export to CSV here and manipulate the data how you want to. Absolutely. Okay, so does that meet the spirit of the question there, James? We're good?
Absolutely. Thank you.
Sure. All right, the next scenario, then I will take you to condition registry. And here, just a reminder, we're still in Dr. Jeff's patient panel. And in this case, we're gonna actually drive down to a subset of his patients. These patients are elderly patients who are at high risk of COVID-19. Just to give you an idea of how well we can drill into the patient cohorts or the patient populations we want to act upon. So here I'm going to remove, so you'll see here I've got 3 conditions just under the COVID-19 high-risk elderly patients that we just chose. You'll see diabetes, hypertension, and coronary artery disease. In this case, I only want to pick 2 conditions that overlay that. And so I can find here 18 patients of Dr. Jeff's. They're elderly, high risk of COVID, and they have diabetes and hypertension. And if this is a particular set of patients that I want to take care of or want to reach out to, then I can do that. So a lot of different ways to find patients who need something, you know, maybe need extra care. So that's another example. And then let's go to metrics. And this is, I didn't reset this, but it's a good opportunity to explain. So we can, as we choose these subsets of patients in this initiatives dropdown, which is where I chose the COVID-19 high-risk elderly patients, you can choose to apply certain metrics to that very specific population. So this is a good combination, actually. We don't, in this demo system, we don't have a lot of data in here regarding immunizations yet, but we've applied now, we've gotten Dr. Jeff's patients who are at high risk, elderly, you know, high risk of getting COVID, and now we've applied the COVID immunization metric to them, so we can be very, very specific about who we want to reach to. That was a little extra there. So let's see, let's go to, I'm going to reset. We're going to look at the whole population for this, and we're going to select another metric. This one will also be a UDS metric. Now we're looking at hemoglobin A1C. And I like this metric because there's a couple things you can do with it. So for the entire population in this demo system, now we're looking at this metric. And if we scroll down to the bottom, this metric is further stratified, and it gets you to a great list of patients to manage, which are patients who have never had a test. We don't have a hemoglobin A1C result on file, you know, in the system for them. And so if I want to find out, I mean, these patients are patients, I have no idea what's going on with their diabetes. I just don't have a hemoglobin A1C there. We can go directly to that no test within that metric and find that list and act upon that. So lots of ways, probably overwhelming you with lists of patients that you can act upon. The last one that I'll do, and then we'll transfer this list over to Brian, is patients not seen. And so this one is near and dear to my heart because I was very comfortable with, you know, the patients I saw. You know, I knew what was going on with them. I'd seen them in the office. I felt up to date in their care. But the ones that kept me up at night were always the patients who I hadn't seen in a while. And, you know, we call it lost to follow up, right? And so this tool allows you to find those patients. They're in your panel, they're attributed to you, you're somehow responsible for their care, but you haven't seen them in a while. And so this tool actually tells you when you've last seen patients in your panel. And here you can see in the red, right? So we've got various levels of this, last seen between 3 and 6 months ago, between 6 months and a year. The pink is 1 to 2 years, and then the red ones are the ones I'm worried about. These are the patients that are last seen more than 2 years ago. And so we can find those patients of Dr. Jeff's. We can further filter them, or if 57 is a lot to do, we can go at it by gaps in care or by risk score. But in the end result, we want to get in touch with these patients, and we want them to be seen. So we will go ahead and we're going to export just like we did before. So I can export it to Brian, and we can take action on these patients. So let me stop sharing so that we get Brian ready to roll with the list.
Great, thanks, Dr. Jen. So let me go ahead and go back into the NextGen EHR. Again, I'll come up here and go into the Population Management Hub module. And this is where I can catch that list of patients. So I can go ahead and import them, and then I can have that patient's not seen list here. And then I can do whatever I need to do. And I showed you before where I can do bulk orders, and I can message those patients through outreach. Some other things you can do, you can select a patient, and then on the right-hand side, you'll get a little window into the patient's chart, so you don't have to open it up. You can quickly see all the pertinent information, and each user can have different profiles and customize how that view looks depending on what kind of list they're working with. They can quickly go into the patient's chart from here. They can preset, define templates that they commonly use. So I can create a new encounter and go into the homepage template, or I can go into the 616 encounter into the homepage template and continue updating. So if I select that, you'll see that in the background that it actually opened up the patient's chart. So I can go ahead and continue documenting. But if I come back here, I can do other things. I can put the selected patients on a recall plan. So if you take advantage of the NextGen recall plan, you can do that. You can message patients like the outreach or patient portal. I can task patients from here. So whether it's EHR or PM, I can create tasks from here. So I can create an EHR task, route it to whoever to take care of that group of patients that I've selected. I can launch into the referral template for this patient. And then I can do whatever I need to. I can create a referral. I can actually access NextGen Share, so I can tap into the over 1 million providers in our connected community. I can generate documents, so I can have that full access to my EHR library and generate a document for that patient. I can also access our patient education, so I can come here and browse and grab the different topics of education and generate that for the patients. I can put chart alerts on the selected patients. And I can also schedule a future appointment for, say, for Mark. So I can go ahead and select, come here and go ahead and book that appointment in the future. So I can do all kinds of things depending on what your needs are for that population that you want to reach out to.
I kind of teased Brian about this. I'm like, boy, I think that ought to just, make coffee for me in the morning. Right? It does so much from there. All that ordering and alerting and scheduling, that's a lot of stuff you can do right there. So I think, Brian, that covered pretty well finding those population level insights and then acting upon, those groups of patients. And now we're going to switch gears and do that second part, which is really, what do you do when you've got the patient in front of you, and how can you use population health right at the point of care when you're in the EHR?
Exactly. As Matthew pointed out earlier in the presentation, this is the third thing that we wanted to highlight. And as a caregiver, nurse, a doctor, you're walking into the exam room or about ready to walk into the exam room. As you bring up the patient in your different ways, you'll notice over on the right-hand side, this little new thing, we call it our little ribbon or traffic light here. So before you even walk in, before you even start talking to the patient, we can help focus what needs attention. So here for Kim, I can quickly see the gaps in care that are past, the ones that are near due, past due, that are failed, and also those risk levels that Dr. Jen pointed out. So I can either hover over the little circle or just click on it and I can get more detailed information without even going up to Pop Health. So as a user, this might be my information, my insights that I received from Pop Health without even logging into it directly. But I can view the patient's profile or chart per se by just clicking here, and I can launch right into the Pop Health for that patient and get more detailed information about the patient. Whether you need more detailed information about the risk levels, you can go ahead and click and bring that up. But again, every time you bring a patient up, that ribbon is automatically there for you. It will automatically pull up the patient that you have in context, and you can access these gaps in care and risk levels real easy and real quickly.
Now, one of the things that I like about that so much is that it tells you what you can do for the patient today. You know, that answers that question, right? If I'm really focused on gaps in care and want to act on those, that's perfect for that. If you just want to have an objective view of their risk score, I think it's also very helpful too. That in my mind helps with clinical decision making. You know, if I have that objective understanding, I may have a gestalt about that patient from having seen them over time. I kind of know-ish, but boy, you know, having that actual risk score just makes it really objective. And I don't know, it's kind of a little jolt. Like, oh yeah, they really are sick. Or not. Yeah.
Dr. Jen, we have a couple questions that have come in.
Great. Wonderful.
The first one is going to be near and dear to your heart. Can you showcase a little bit about the platform and what we can do within our pediatric populations?
Well, let me see. So, Brian, you're going to have to give me back the power. Power to share. Here we go. Great. So a couple things with pediatrics. We do have first of all, a set of metrics that are pediatric specific. Some of the ECQMs definitely are for pediatric populations. I don't really have the demo system set up for that per se. But here, you know, we can show pediatric breakdowns within when we look at our population as a whole. So if we go to age, we can further do the pediatric breakdown to get a sense of who our patients are there. That's one way. If we go to condition registry, we have a number of pediatric conditions. Let's deselect something. We're building new conditions all the time. So for me, I would have loved to have known who, you know, say I'm, you know, Dr. Jeff still, I would have loved to have been able to pull up a patient list, all my patients with ADHD. You know, that would have been so helpful for me to understand. And then if I would have taken this list here, and I would have, in this case, I don't have that many, but I would have wanted to make sure that I'd seen them in the last 6 months to do their ADHD follow-ups as appropriate. And you can go in and get their last appointments in there so you can see that. So that would have been unbelievably helpful. Like I talked about metrics, gaps, and again, patients not seen. So those are just a few of the ways that this could be used in a pediatric population. That was a quick overview, but hopefully that gave you a sense. Other questions, James?
Yes, and I'll take this next one. So the spirit of the question is, how quickly can I get this platform? And so we would be very happy to partner with you. Generally speaking, the implementation methodology takes approximately 4 to 6 weeks. So it does move very quickly in terms of time to value, and it's a very collaborative implementation with our team where you would have a project manager, clinicians helping to shape your metrics and validate metrics along the way. But generally speaking, implementation is about 4 to 6 weeks. The next question is for Matthew as it relates to the ribbon as it's referenced. So you're showcasing gaps in care and risk. Is there going to be additional information brought into the ribbon?
Yeah, so it's a great question, and it's definitely a segue in terms of as we look at the product and where we want to focus. I think there's 2 things that I would highlight. One would be while the application is, intended to be, really easy to use and make it easy to find, whether it's pediatric patients or otherwise, in the application, that's great. And we know that providers sometimes just don't have time for that. And so that's why the ribbon's there. And so the reason I mention that is because we feel like that's going to be an important conduit through which we communicate future information. So, we actually have spent some time in focus groups with clients as recently as the last month, working through and sort of trialing out, hey, if we could get this information, from a payer or this information from a lab, would that be useful and what would that look like? And in doing so, the intention for us in terms of the next iteration with the ribbon is going to be to give users the ability to personalize the ribbon. So we're working through just kind of some options in terms of what that looks like, but it does give you some foreshadowing of definitely there's more to come in terms of actionability, other insights, and personalization.
Terrific, Matthew. Dr. Jen, we've got a number of questions that I think relate to our condition registry. So a couple different conditions that our audience are looking to isolate on. So perhaps within condition registry, we showcase a little bit for asthmatics.
Oh.
If we could showcase that first and foremost.
Sure. Okay. I jumped the gun and passed the power to Brandon. He's giving it to me back. Hang on just a second and we'll get back there. Yes. So just in terms of, do we have these specific ones? All right. It's asthma. Hang on. Yep.
Terrific. And also related, any additional elements within condition registry and the drop down on behavioral health?
Yeah, good. Depression. We can do, I wonder if bipolar's in there. Yep. Bipolar, substance use. We have a number. And like I said, this is always growing as our clients find more value in it. So yes, bipolar disease. We do 3 at a time. That's the max. Let's see if I can also do anxiety. Anxiety disorders include PTSD. Lots of different ways, yes, of looking at this.
I'm going to throw another one at you, Dr. Jen, that just came in, tobacco usage.
Oh yeah, I think so. I want to say it's substance, and I thought there was a tobacco. Let me try tobacco. Thought we had it under that, but it may be different.
I thought I saw
tobacco use. Yep, there it is,
right.
Tobacco use. Yeah.
Terrific.
I don't have anybody with us in this demo system, but yep, we do.
Great. Great showcase of condition registry and the flexibility there. Yeah. Additional question has come in. Will this work with other EHRs beyond NextGen? And absolutely, we've worked with other well-known logoed EHRs in the industry, and we have the ability, and I think at its core, the platform itself is very flexible in terms of ingesting those multiple insights. So as we talk about other EHR platforms, claims feeds as an example, lab feeds, pharmacy feeds, the robustness of the platform really is delivered by the ability for us to ingest multi-source data. So absolutely, we can work with other EHR vendors that might be out there.
Yeah, to add on to that, James, part of the way that we do that is, as you said, the system has the ability to multi-source data, but then the ribbon that Brian showed in terms of that, certainly visible within NextGen Enterprise, but also that's really powered by a third party that we use. And so part of the reason for that from a strategic perspective is that ribbon is already integrated and built into a number of other EHRs. So whether it's ECW, MedEnt, Cerner, there's a number of other EHRs where that works. Now, some of the other things that Brian was showing you in terms of the bulk ordering and some of those things, that's not necessarily available in terms of as easily as Brian showed, because that's really getting into the actual EHR system. So But with that, I think we're ready to kind of recap and kind of go from there for any final questions. So I just wanted to take a few minutes just to kind of reflect on and kind of remind folks of what they saw. So again, we started with that the belief that kind of regardless of where you are on that spectrum, whether you're fee for service or, taking double-sided risk or somewhere in between, you hopefully can find yourself there. And then so then we pivoted to kind of the observations from some of our research in terms of, physicians feeling like they're overwhelmed with information, like they don't have the data insights that they want, like they're spending too much time in the system. And so that's where this piece that we were just talking about with the ribbon, where we feel like that's really a key differentiator. So how do we, give a system and make it available where if the user has the time to go into and sift for the insights that they want, that they can do that really easily and then take action on it. But if they don't, that we're pushing those specific insights in a very concise way to the context of where the doctors live. So we're not having to interrupt the workflow for a condition or for a clinician. And it reduces time ultimately that he or she spends in the system. And so again, those insights are very specific and timely to that particular patient, and they're just waiting there for the clinician to look at. And so, what you saw pieces of was really everything in those boxes that are highlighted, at least by the top in terms of the orange column. So population health, actionability hub, care coordination. So everything that comes with the core product is really in there. And we can certainly take more time to show you what that looks like, but we wanted to give you this kind of summary snapshot of what those capabilities were. And then depending upon your appetite, depending upon the availability of certain information like claims feeds, whether it's from CMS or a commercial payer, there's more things that we can do in a modular fashion, which, doesn't change the look and feel of the application. Really, it's just more tabs show up in that interface that Dr. Jen walked you through. But this is a quick sneak of, really everything that you saw. And then, the intent behind this slide is really to give you just a quick snapshot of just, the breadth and depth of the clients that we have. So at this point, we've been very fortunate. We've got over 100 clients in the system, 8.5 million lives, roughly 8,500 users in the system. And, right at 50% of our clients are FQHCs. So, and that ranges from FQHCs that are very small up to, ACOs or CINs that are quite large with, 4 different systems, and they've got 25 different EHRs and kind of everywhere in between. So the purpose for that, sharing that information, certainly is not, sort of chest thumping. It's more to just give you perspective of, I think with that kind of volume, there's a support process behind this. We've got a client services team. We've got a product team, many of whom you see today on the phone or on the Zoom call, and there's, a development team. So it's not, one person doing 6 different jobs. We've got a team of people doing QA and support and client support, all those things. So just to let you know that there's robustness behind the product in terms of how it's delivered, how it's implemented and supported. And, just to wrap it up in terms of, as we think about this work, part of what, comes through is really, this is geared towards fundamentally helping clinicians in their practices get credit, most likely for the work that they're already doing, right? And so there is a lot of button checking and, different things to do, but, without making sure that you're maximizing and realizing the revenue streams that you have access to, then you can't do the mission. You can't, sort of focus on the why that you got into practice. And then part of this, and we've actually heard this from Dr. Jansen that's highlighted here below, is that some of what's here is, activating the patient really helps you become more successful. So in some cases, some of our physicians do that by showing them the ribbon and the scores that their patients have in the exam room, because just seeing the score, kind of like Dr. Jen said, just makes it more real. But in some cases, it's using the tools that Brian highlighted to really reach out and, you know, make patients aware of in advance and proactively what's going on. And lastly, you know, last but not least, it's really focusing on how can we use these tools to actually help improve physician engagement. So, you know, the ribbon, you know, makes it simpler for the physician to use. And, you know, we've heard from, again, other clients repeatedly that in some cases, very few of their clinicians actually get into the application and do the searching and, you know, kind of pick on the registry or the condition and that kind of stuff, because they just don't have that time. And so, but they still find the ribbon incredibly useful. And you can see here just a quote from Dr. Jansen in terms of just, you know, making sure that people are operating at the, you know, I always call it at the top of their license to really do what they're paid and trained to do. And so lastly, just, you know, if you've got more questions, as James said at the outset, you know, we'd be happy to, you know, speak with you. Again, this was a flyby. We can spend hours training people on certain aspects of this, but hopefully what you got to see was that there's a really powerful set of capabilities that helps you generate insights. There's a lot of capabilities that are well integrated in terms of that can help you take action on it proactively and reach out, and also giving you concise bits of information at the point of care. So with that, James or our NextGen Healthcare hosts, are there any questions that might be looming out there from the group?
We do have one additional question, and it relates to our suggested position or leadership on the clinical side that might be helpful as the client adopts. So Dr. Jen, I'm sure you can offer some perspective in terms of clinical champions and having knowledge around workflows and the ability to kind of work with us in a collaborative model as part of our implementation. Maybe you could speak to that.
Absolutely. Absolutely. Yes. So, and in fact, that was where I first learned what I know about the tool, right? Was working with the clinical consultants and on that with that implementation team. So there are 2 physicians and 2 nurses that are part of the clinical consulting team. We also have other nurses on other parts of the staff as well, right? And they are part of the implementation team and services. So absolutely, they are out there wanting to make sure that the product works for you specifically. They want to take in, like, what programs are you participating in? What do you see as the benefit of this tool? They're trying to get you there. That's their whole focus right now. So they're there with you. They're there on an ongoing basis. And they're just a great group. Also, we'll furnish you with best practices, some of which you've seen today. So yeah, absolutely. A lot of support there for you.
Terrific. Thank you, Dr. Jen. So that covers, and we're up to date in terms of the questions that we've received.
All right.
Super.
Well, thank you for spending time with us this afternoon. Hopefully you found some value in what you saw. And again, as we've said several times, happy to continue to engage in whatever conversations we can to help you be successful in the work that you're doing. So thank you for doing what you do, and thank you for your gift of time today. We appreciate it.